First of all, I'd like to thank EP Plus for organizing today's webinar and for inviting the National Stroke Association of Malaysia or NASAM to facilitate. I'm Tracy Chan, a physiotherapist and head of rehab at NASAM. We have been serving the stroke community in Malaysia for 26 years through our 8 centers around Malaysia, from as far as Sabah down to Johor. Due to the pandemic, NASAM is providing telehealth as an alternative to on-site sessions at its centers. We have individual as well as group sessions via Zoom. For those who are not able to follow online sessions, there is the physical face-to-face session. October is a special month. For on the 29th of October, it's World Stroke Day. This year, WSO, or the World Stroke Organization, has a Precious Time campaign, which seeks to raise awareness to recognize stroke signs fast and rushing to the hospital for emergency treatment. Stroke affects 1 in 4 people in their lifetime, where it used to be 1 in 6. It is the 3rd leading cause of death in Malaysia. Every year, 50,000 people are affected by stroke, and about 40 of them are below the age of 60. So it's your relatives, it's your family members, it's your friends. The reality is a stroke can happen to any of us, yet it is preventable. Today, we're going to discuss regaining life after stroke. Before I hand you over to the first speaker, let me share a brief introduction about this gentleman. Associate Professor Dr. Hu Fan Ki is a neurologist, a general physician, and a senior lecturer at the University Putra Malaysia. Serves in Hospital Pengajar University Putra Malaysia, Malaysia's first stroke-specific hospital. He also practices at Beacon Hospital in PJ. He is currently president of the Malaysian Stroke Council. He has been involved in many trials of emerging stroke treatment and has published numerous original papers in stroke, hypertension, and general medicine. Over to you, Prof. Hu.
Thank you, Tracy, for the very kind introduction. So thank you for the organizer, for the Alpro Pharmacy and the EP Plus for inviting me for sharing this session. So I would like to start with my session. So what is a warning sign of stroke? So we can use the acronym of BEFAST or FAST. So what is BEFAST? B stands for the patient may have this balance difficulty. I stands for eyesight changes. Face stands for face weakness. A stands for arm weakness. S stands for speech difficulty. T is time for call 999. So those are stroke symptoms. It happen very suddenly, very abrupt. It happen just very fast. So you have to remember this is the mnemonic or acronym, short form for the warning sign for stroke. And how we spot a stroke, the easier way for you to remember is using the face. So the F is stand for face drooping, A is stand for arm weakness, S is stand for speech difficulty, again T is stand for time to call 999. So what are the risk factors to how you get a stroke? Of course, when you get older, the risk of stroke is getting higher because your vessel is become more hardening. Of course, certain lifestyle like smoking, obese, eating unhealthy food like very high calorie diet, very high salt content diet or salty food, or you have underlying medical condition like high blood pressure, diabetes, atrial fibrillation, high cholesterol, certain anemic as well, and a very strong family history that you may suffer from stroke. So up to 80% of stroke is preventable. So it can happen at any age, anytime. So how are we going to, bring down the risk of the stroke? Of course, if you suffer from hypertension, you can lower down your blood pressure by reducing taking medication, by doing more exercise. The same thing also apply for diabetes. If your sugar is very high, so control your sugar, doing some exercise, control your diet to lose some weight. High cholesterol as well, exercise more. If you are a smoker, quit smoking. If you are drink more, try to do it in a moderation. If you have underlying heart problem like atrial fibrillation, you may have some irregular heart rhythm. This will lead to a different kind of stroke. So overview, how do we treat a stroke? So basically, the stroke, there is a golden hours or golden period. So we need to remove the blood clot. As we know, 80% of the stroke is due to there is a clot in the blood vessel. So it blocks the blood flow to the brain. So they will be causing a lacking of oxygen supply to the brain area. So at the same time, we also try to treat the complication if the patient suffer from the stroke complication. Last but not least, something like the role of Tracy, like actively promoting the patient stroke recovery. Physiotherapy is very important. Of course, some medication also can promote the stroke recovery. Last, the fourth important point is secondary stroke prevention. What do we mean by that? So we want to prevent another stroke, because most of patients, after they suffer from the first stroke, they tends to have another stroke, which is usually worsening as compared to the first or the second if it happened the third time. So this is something we need to focus. So this is the diagram to illustrate if there is a clot here. So we try to remove the clot by all means. So how do we remove the clots? So yeah, the doctor can give you the medication to break down the clot, or this is the medication, it causes altiplase, or the doctor can do some surgery by manually to take out the clot by certain stent. So this is the something a coil wire to pull out the clot. So the timing is very important before the brain tissue or the brain cell is fully died because of lacking of oxygen supply. So less than 3 hours, the patient tends to recover fully 30 to 40%, or 3 to 4 hours, the patient may recover 15 to 30%. So you can see there's a 50% drop if the patient arrives to the hospital within 3 to 4 hours. So the earlier, the better. So time is very important. So time is brain. So get to the right hospital is also very important, because not all the hospitals are trained to give this to remove the clot, what we call reperfusion therapy. So what you can do, this is a very important slide. So you can snapshot. So this is a website with collaborating with NASA Angel Initiative. So we come up with this website. So you just press this locate. So it show you the nearest hospital, either private or public hospital. So either the hospital are ready for 24/7 to treat stroke patient. So if the patient suffer from stroke complication, lung infections, then we start with antibiotic. If the patient suffer pressure sore, we have to treat the wound. If there's a clot, then we have to start some blood thinner to treat the clot. If the patient suffer from some urine infection, then we start with some antibiotic. If the patient having swelling, then we may refer the patient to a surgeon to take out the scalp and to release the pressure in the brain. So again, I also like to highlight promote stroke recovery is very important. We will refer the patient to Prof. Lydia or Tracy to start the physiotherapy, start some medication to promote the stroke recovery, which is very important. So secondary stroke prevention to prevent another stroke. So control the risk factor, which is the most important way to reduce the risk of stroke getting back again. So bring down the blood pressure, reduce the sugar, start the patient of blood thinning medication. The most common the drug is aspirin. Start some cholesterol medication, which is something very commonly we start by the doctor, which is statin. So this is an overview again. If you never suffer from stroke, then we call primary the prevention. If you suffer from stroke, you have to rush to the hospital, to the right hospital. If you don't know which hospital is the right one, so you check the website mystrokehospital.my. So this is they will treat you as I told you. They will try to deal with the clot and remove the clot by medication or by surgery. And another important point of the stroke treatment is prevent another stroke, as I shared with you in the previous slide. So cost, of course, is very important. If you have insurance, you can go to the private hospital. If you don't have any insurance, you can go to the hospital as below. But again, cost doesn't matter, and we have worked very closely with some NGO. They will support some fund to fund those surgery, because the stent is quite expensive, could be up to 20 to 30,000. So go to the nearest hospital as soon as possible, because the timing is very important. If you go to the hospital late, so you already missed the boat, so you may reduce the chance for a full recovery. So again, summary of my thought. So recognize the warning sign. The simple one is the face, or you can use BEFAST. BEFAST is even more accurate, and go to the nearest hospital as soon as possible. So this is a website. Thank you very much. So I will pass back the floor to Tracy.
Thank you very much, Prof. Hu. That was wonderful and very, very concise. Can't even look at my camera. Okay, I've got some questions here, Prof. Hu, if you don't mind. You are with the Malaysian Stroke Council or MSC. Can you tell us its role?
Pardon?
Sorry, can I repeat that? You are with the Malaysian Stroke Council?
Yeah, I'm the Malaysian
Can you
Stroke
tell
Council.
us its role?
So basically, our role is a platform to connect all the doctors. So basically, the group is formed by a group of neurologists. So in the beginning of a few years ago, about 3 to 5 years ago, most of the stroke patients are treated by the neurologists. But again, we have this problem. We only have about 100 plus of neurologists, and yet 50% of them work in the private. And we know that 70% of the Malaysia public, they go to public hospital, 70% of the patients. So 50% of the neurologists is just not enough to cover the stroke patients. So we have this effort from neurologists that we try to train non-neurologists, for example, general physicians, emergency physicians, try to, take over our role so we can reach more patients, even though in the remote area, to start this emergency stroke treatment. So we try to save more patients in the golden hour, which is less than 4.5 hours. So the Malaysian Stroke Council provide a platform to connect everyone A to Z, for example, from emergency physician until the end, like Tracy or Nasam. So we work together under the same umbrella. So at the end, we are more like at the side of the health care provider to connect everyone. So it's not about neurology, it's about everyone under the healthcare provider, so we can collaborate each other so we can help more patients together.
Thank you, Prof. Hu. I have a question from the chat group, the audience. For post-stroke, would you recommend any supplements or oral treatment for health maintenance or recovery purposes?
So again, there are many clinical trials, for example, that Japan have been using very thoroughly, like something like IV, the Evadarone, which is in every stroke patients. So it's not uncommon that, something like neuroprotection therapy to improve, or neuro recovery therapy to improve stroke recovery. So another thing which is available in the market in Malaysia, so something we call a lot of doctors have a very good experience with that. So some doctor may recommend certain patient to start. So of course, physiotherapy is very important. So we cannot neglect the role of the physiotherapy on at the same time. So we can add some medication to promote the stroke recovery.
Right. So let me recap. Most important thing is recognize the stroke signs, BEFAST, balance, eyes, face, arms, speech, and time. Get to the hospital as soon as you can. Dial 999. Know your risk factors and manage them. When you feel there's a stroke coming, go to the nearest hospital as quickly as possible, because time is brain. If you're looking for a stroke hospital, you can go to My Stroke Hospital website to find out which one.